At the Digestive Health Institute, one of our common values is that we want to bring academic medical care to people where they live. And really, that was the impetus to developing the Center for Advanced Endoscopy. We wanted to provide patients in the western suburbs and in those areas the same basic accessibility to these high-level endoscopic procedures that typically they would have to drive into the city for. We found that when we were looking at the demographics that this was an area that was underserved in terms of that capacity. So if someone had a potential diagnosis, say, of pancreatic cancer, that's not something you want someone waiting 4 or 6 weeks to get confirmed. Those patients want to be seen fast, and they want to be seen by experts. The Center for Advanced Endoscopy is going to expedite care. So instead of having patients wait for a referral downtown, we're going to be able to get people in a streamlined fashion, the same technologies, the same diagnostics, and get them to the same care plan at a very fast pace. What makes that special is that instead of actually having patients get diagnosed with the disease that requires an endoscopic procedure that might not be able to be done in a community hospital, instead of having them travel all the way to downtown Chicago, now they'll be able to be assessed and taken care of where they live, closer to home, maybe a 30-minute drive. Now, in terms of innovation, that doesn't sound very innovative because you're just adding the same technologies. But people don't understand that providing that same level of care is not just putting the same machines there, it's also bringing the same level of endoscopists. And what we were able to do with this is really recruit Amrita Sethi, who is a world-renowned endoscopist, to come lead that effort. So now we're a center that has 2 centers with world experts operating in different parts of the city, interacting and collaborating and sharing. We'll probably be one of the first places to actually have 2 high-level endoscopic centers, which gives us the ability to actually interact and network with all of the Chicagoland area. So I think the launch of this particular center is really going to be the nidus for our real value and mission of the Digestive Health Institute, which is really to bring academic medical care to people where they live. Now what we're able to do is be much more flexible. So we can even envision a point where we may be diagnosing patients in other parts of the region and sending them to the Center for Advanced Endoscopy at CDH instead of bringing them downtown. So once again, providing flexibility. In addition, there will be a lot of collaboration between the 2 centers, the CDH Center and the NMH Center, where new ideas, new innovations, and new technologies will definitely come from. So we're really excited about having 2 academic medical centers in terms of endoscopy working together in the same network. One of the things that we're really excited about in terms of the Center for Advanced Endoscopy at Central DuPage Hospital is the opportunity to have an innovation hub where we can actually work with our industry partners in a very seamless way to test new technologies. So maybe, for instance, something like a robotic endoscopy platform, but not just test it. We really want to be involved in improving these particular technologies, and that's what we're going to have the opportunity to do at the Center for Advanced Endoscopy at CDH. So we contemplated this, and we were able to conceptualize it, and now it is underway, and we're really excited about this opening in April of 2026.